My name is Kaitlyn Hurley. I'm a Term 2 student in Section 5 in the ADA program, and I will be demonstrating IV insertion today. The first thing I will do is check my doctor's orders to make sure the IV is what I'm supposed to be doing and it's correct. I will go into the emergency room, knock, and do hand hygiene. I will identify myself and identify the patient using two forms of ID, being their name and birthday, and double check on their wristband. I will ask the client if they have any allergies to anything, and then I will then explain the procedure to them. I will be using a 20 gauge needle for the type of procedure, and it is correct with the doctor's orders. And then I'm going to start. So, my hand hygiene, in choosing the site for the vein, I will use 4 identifiers. I'll ask the client if they've had a mastectomy or any fistulas that I should know about and do it on the opposite side. I will ask if they are right-handed or left-handed, and so that arm won't interfere with their ADLs. I will choose a vein that is soft and bounding and the one that is most distal. Today it will be done on the right forearm. And I'm going to go ahead and prime my tubing. This is sterile, so I will open this up and connect my syringe. I will go ahead and make sure it's unclamped and prime the tubing. And clamp back using positive pressure. Okay. Place this in here. I'm going to, okay, so look for my vein, and I've chosen my site. I'm going to then apply the tourniquet. It's going to be 4 to 6 inches above the chosen site. I'm going to check for a radial pulse. I can feel one, and then I'm going to clean. I've chosen insertion site. Right here. Clean in concentric circles moving outward, and then I will allow that to air dry. Take my needle, double checking using a 20 gauge. Okay. Once this is dry, I'm going to pull the skin taut about 1 inch below where I want to go, making sure I don't touch the area that I just cleaned. I'm going to insert the needle, level up at a 15-degree angle, warn the client of a sharp prick. Okay. Once I observe flashback, I'm going to lower the needle and advance the catheter at the same time. And I'm going to continue about 1/8 to 1/4 of an inch until the hub rests on the patient's skin. I'm going to apply pressure, remove the needle, pop the tourniquet, and attach the syringe. Okay. Once this is complete, I'm going to unclamp my syringe, and using the push-stop method, I'm going to prime. However, I will first aspirate for blood flow. I see that, and so I'm going to push every 0.5 milliliter, stop, push, stop, push, stop. And on the last 0.5 milliliter, I'm going to push and clamp so I have positive pressure. That is complete. I'm going to disconnect my syringe, sit off to the side. I'm going to go ahead and take my tubing down. Last, I'm going to apply the tegaderm. Once I do this, sure not to touch, it's sterile. I will apply it over the insertion site, making sure it doesn't cover it. Going to remove the label, and on the label, which I will put back onto the tegaderm, I will write my initials, the date, the time, the gauge, and the length of the needle was a 20 gauge, 1 inch needle. Apply this over a spot that won't interfere with the IV. Going to now remove my gloves and dispose of these. I'm going to yell sharps to put any needles or syringes into a bin out of the way. And I would later document how many attempts I made, the location of the IV insertion, which is right at forearm, the time and date, again the size and length of the catheter, and the client's response I will also monitor. I will also include any instructions that the client has been given and continue to check on the client.